Gender-based violence is pervasive. 1 in 3 women worldwide have experienced physical or sexual violence. This has dire consequences, increasing poverty and eroding human capital. We have long worried that safety nets may increase gender-based violence. Evidence from around the world shows this isn't true. By reducing poverty and empowering women, safety nets can prevent violence. And by making simple design changes, communicating better and implementing smarter, our programs can do even more. By seizing opportunities to empower women all along the delivery chain, safety nets can further improve their lives and the lives of their communities. Safety First is a toolkit you can dip into, giving design and implementation tips, real-world examples to help your program increase women's empowerment and contribute to violence prevention at every stage of the delivery chain. And that means a virtuous circle of better outcomes for women, for families, and for society as a whole.
Thank you so much for that powerful video. I'm seeing so many panelists starting to join us. I wonder if we can share the opening slide, Nina. That would be great. Welcome, everybody. We're just waiting for colleagues to join us. You are joining us for the webinar on the potential of safety nets to prevent gender-based violence, hearing from 4 fantastic panelists around the world with some practical case studies, as well as their own experiences from a policy and programming perspective at the global level. As we wait for people to join us, please feel free to use the chat button at the bottom, where you can just type in where you are joining from. So just to warm things up, my name is Lauren Rumble, and I oversee UNICEF's gender equality portfolio, where we are seeing the profound power of gender-based violence and social protection programming in our work. So excited to hear more today. So yes, if you're joining us, do add where you're joining from in the chat so we can see you. And we will be starting officially in a second. Welcome from Cameroon. Thank you, Bigamba, for kicking us off. Great to see you. While we're doing that, let me just go through some housekeeping. You'll see a range of buttons on the bottom of your Zoom screen. If you go to the far right, there should be a picture of a globe, which will give you the options for interpretation. We're so lucky to have some really, really good interpreters with us joining today in English, French, and Portuguese. So you can just click on which language you prefer to hear in. If you just want to hear in English, do click the English button, as some of the case studies will be presented in a different language. I'm seeing so many wonderful introductions. It really is a global webinar. Let's go to the next slide. So this is who we'll have with us today. I'm the moderator at the bottom. And right, starting from the top, we have Angélica, who is the National Director for Children in Mozambique, Charlotte Coles, who's heading Ending Violence at FCDO, Ruth Graham-Goulder, who is my colleague at UNICEF, a social policy specialist, and Alessandra Heinemann, a senior social protection specialist and gender lead at the World Bank. And what we'll be talking about today is the potential of social protection programming, especially for safety nets, to address gender-based violence from a range of angles: immediate response, mitigation, and prevention. And I'm particularly passionate about this topic because I've worked in countries and seen the tremendous power of social protection programming, putting resources in the hands of poor people so that they can make more informed and empowered choices, and the freedom that that brings. We know that the scourge of violence against women and girls is a public health and human rights crisis in every country in the world, made worse by the COVID-19 pandemic, with children and women locked at home with their abusers, disrupted services, and the crisis of poverty for sure will aggravate these spikes in violence, as well as families now really grappling with increased poverty and risk. Now is the time for bold solutions, and that's exactly what our esteemed panelists are going to be bringing us today. Let's go through quickly who those panelists are. Next slide. So first we'll be hearing from Alessandra, who's working at the World Bank. Her interests include economic inclusion programs, social protection delivery systems, and human-centered design. She's had more than a decade of working in a range of countries, and we're really excited to see and hear about the Safety Toolkit and how that works to really deliver the kinds of programs with impact at scale. So then we will turn to Angélica, who is working with the government of Mozambique at the Ministry of Gender, Children and Social Action, which is where we know some of the most profound programs are happening. She has a long experience there, nearly 19 years, where she's the National Director for Children. And among other responsibilities, she's leading the first national strategy for the prevention and combating of child marriage in the country. Thank you for your phenomenal work, Angélica. And she's also working, of course, on the first national survey on violence against children. We'll be hearing more about how they're using social protection in Mozambique to combat gender-based violence. Next slide. Then we'll be hearing from Ruth, who is our lead on gender responsive social protection at Unicef. She's really done a remarkable thing of supporting countries, 110 in fact, to implement social protection programs that are gender responsive and ultimately transformative. And you can read a little bit more about her experience there, coming from a government role in the UK and now really focusing on bringing more resources to the poorest and most vulnerable children and their families. Next slide. And finally, we'll be hearing from Charlotte. Welcome, Charlotte, who is currently the team leader for ending violence, which is both gender-based violence and child protection at FCDO. And she too brings rich country experience and knows what it means to implement practical programs with impact. So we're really looking forward to hearing from these amazing panelists. We're going to start now a quick Zoom poll. If we can show up the poll. So what you should be seeing on your screen is just some very simple questions to welcome you on so we can get to know a little bit more about you and each other. If you could choose one of these options, how do you identify? As a social protection practitioner, as a gender or gender-based violence practitioner like me, or are you somewhere in between, both, or something else entirely that we don't have on the list? Let's see who we've got online. Let's give it a minute. Okay. Shall we share the results? I think this is actually an amazing result. What we can see online, and I've been on a couple of these webinars over the years, is it's usually either gender or social protection. And what we have today is an overwhelming combination of both, which is showing something quite interesting in what's happening in our community of practices, is how increasingly these are coming together as we recognize the dual connections between the two streams of work. So maybe we'll also get a little bit into where they don't connect and where the challenges still are and how we can overcome these. Welcome also to those who belong in neither group, other. I'm looking forward to your questions and perspectives a little later on as we open for Q&A. Thank you so much. I think we can close the poll and start right away with you, Alessandra. So Alessandra, we watched a powerful video at the beginning of the webinar where we learned a little bit about the World Bank's commitment to ending gender-based violence and improving social safety nets. But you've also launched the Safety First Toolkit. Can you tell us a little bit more about this toolkit? And if you had to summarize the three main messages from the toolkit, what would they be?
Hi, good morning, everyone. And thank you, Lauren. It's a pleasure to be here, and I'm really looking forward to the conversation.
Oh, you might need to speak a little closer to your mic, Alessandra, especially for the older people like me who are going deaf.
Okay, sorry about that. Is that better?
We got you.
Great. So good morning. Thank you so much for having me. It's a pleasure to be here, and I'm really looking forward to the conversation with all of you. If I had to boil everything that's in the Safety First down to 3 messages, I would say the following. First, chances are your safety net project is already reducing gender-based violence, so you might as well try and do so intentionally. Second, you can harness the preventive potential of safety nets through simple design and implementation tweaks that add up to significant gains. And third, we're not asking social protection practitioners to design violence prevention projects. I think about 80% of the recommendations that are in the Safety First are really just about thoughtful and inclusive design. So let me expand on each one of those 3 messages just a little bit. Message number 1, chances are your safety net project is already reducing gender-based violence. So that's obviously really great news. But I think there is reason to believe that more intentional design might get us even better results. There is a growing body of research suggesting that even when cash transfers are designed without violence prevention in mind, they still end up reducing violence against women and children. So rather than violence prevention being this kind of, lucky unintended consequence, if you like, I think social protection practitioners should take advantage of that insight and really, exploit those positive externalities. And the Safety First Toolkit is a guide to helping you systematically identify those various entry points that you have for violence prevention in a cash transfer program. I think one of the reasons for optimism is that the effect of cash transfers in curbing violence against women and children can be really substantial and comparable to the effects of standalone violence prevention interventions. So given the global reach of cash transfers among the poorest and most vulnerable, I think this is a really exciting opportunity. Message number 2, you can harness the preventive potential of safety nets through simple design and implementation tweaks. As we saw in the video, the Safety First Toolkit is organized around the social protection delivery chain. So it's intentionally designed in a way that you can kind of go straight to the phase of program implementation that you're currently grappling with and, look at entry points and tweaks within that stage. So it's not something you have to read back to front. You can really sort of use it as a manual and troubleshoot, if you like, as you're implementing your program. It offers tweaks, ideas for tweaks at every step that can help you amplify the protective and empowering effect of safety nets. And it outlines risks, opportunities, and mitigation measures that should help you make informed choices and navigate trade-offs. So for example, at the outreach phase, the toolkit suggests that you might be able to explore how to communicate program objectives in a way that helps shift gender norms, drawing on the evidence from labeling. This is, of course, also a stage where it's really important to think about the potential risk of backlash. So it asks you to remember to work with norm holders and influencers who might, might help you prevent sanctions against women for participating in the program. Message number 3, and I think this is an important one. This is not about, turning every social protection specialist into a violence prevention specialist. Obviously, that is an expertise of its own. I think colleagues, have said to me, colleagues who have used the toolkit, they have said to me, this is actually, we feel like 80% of what's in here is not necessarily about violence prevention per se. It's really just about good gender design. And I think that's true. So the toolkit brings together evidence and examples from a range of low and middle income countries. But of course, this is not a cut and paste job, and the social norms and the drivers of violence are very context specific. So what each section does is that it begins with a series of questions to help you think through the issues for your specific context. And our hope is that these will inspire you to come up with, other solutions and approaches that we might not have thought of.
Thank you so much, Alessandra, for those key messages. And I wonder what our panelists are thinking about one of the first almost controversial ones, which is that you don't, a well-designed program will reduce gender-based violence in itself inevitably. So looking forward to hearing some responses on that finding from, I know, quite a body of evidence, and unpacking that a little bit. I want to ask you a bit about what we might be missing. What do you think are some of the opportunities that or well-known activities and processes that are being overlooked that we know can reduce gender-based violence in social protection programming, either a process or an activity? What are we missing?
So I think one of the really interesting ones from the impact evaluation literature that I think
a little closer again.
Oh,
there we go. There we go.
So I think one of the interesting ones from the impact evaluation literature that I think as social protection practitioners we don't usually use to our advantage is the evidence around women's social capital and the importance of groups and networks. So I think as social protection practitioners, we're often very focused on the household as the unit of analysis, and we don't really use opportunities to strengthen women's groups and networks through our programming. So I think we could do a lot more to leverage and strengthen women's groups in the design and implementation of cash transfers. So for example, obviously involving them from the get-go in the design to solicit feedback and input, but also throughout the implementation process. I think in the COVID pandemic, we have seen some programs really partner with women's groups in interesting ways. For instance, to have them help in the outreach and enrollment process to reach more women, but also in the delivery of services and complementary measures, as part of lockdowns and sort of limited implementation capacity. So I think looking systematically at opportunities to build women's skills and confidence and support their kind of existing networks is something that would be feasible for social protection programs to do, and is hopefully something that would boost outcomes across a range of issues that we care about.
Thank you so much, Alessandra. I love that last observation around supporting women and girls, networks, groups, and social capital. And looking forward to hearing from our panelists further about how they might be examples of that in their programs. We have so many colleagues online. I can see coming from countries who are either in the social protection space or gender-based violence space. So really looking forward to their insights. Let me just point to the chat box. We do have the Safety First Toolkit link in the chat box if anybody wants to download it, as well as access to the video that Alessandra was talking about. And please feel free to put questions as they're coming to your mind into the chat. You don't have to formally wait until the Q&A session, which I'll be starting in around 45 minutes or so. Let me turn next now. Thank you so much, Alessandra, to our next panelist, which is Angélica. Angélica, we'd love to see you on camera. Bom dia. Angélica is joining us from the government of Mozambique, and we're really excited to hear about...
Boa tarde.
Boa tarde. I'm looking forward to hearing more about the government of Mozambique's Child Grant Program. Could you tell us a little bit about how it works and the different components of it?
Muito obrigada.
After listening to the first presentation, we rest assured we are on the right track, because our country knows exactly how the violence based on gender is something that has to be addressed. We need to prevent violence like this. There has been an evolution in the regulation and to strengthen the visibility. We right now are implementing our second strategy of social protection. And within the different programs, we have one that is specific, and we believe it has a very important role. It's going to help with social development, social protection, and prevention of the gender-based violence. I'm going to explain about one of the programs that we've implemented. Is the basic subside program. And within this program, there are other programs, and this is what I want to share with you. We think this has a great potential, which is the child subsidy program for children from 0 to 2 years old. We are implementing this in the country now to intervene in the prevention and the fight against chronic malnutrition of children, because our malnutrition rates are very elevated at the moment. And one research that the government has carried out showed that we have 43% of malnutrition in the country for children below 5 years old. And this is to fight malnutrition and to assist children who are under the risk of malnutrition. There are several studies that when malnutrition or elements of malnutrition are there when children are above 2 years old, the child is at risk. We need to do something to mitigate this. So in regard to the child subsidy program, there are 3 actions that we take. Children from 0 to 2 years old, and children who belong to vulnerable families and who are under the risk of malnutrition. This program has 2 components, subcomponents. The subcomponent of money transfer, in which the child or the caretaker, and 90% of the caretakers are their mothers, they would receive around $8 a month during 24 months and during while they are under the program. The second subcomponent is the policy of care. And within this care, there are 2 different approaches.
We have a package of nutritional education. The families receive information regarding nutrition, how they should prepare the food for the kids, health issues related to nutrition, and other forms of maintaining nutrition for children and consequently for the whole family. The other component is case management, is where we have monitoring and the potential of preventing violence-based, gender-based violence. I want to highlight that not all beneficiaries have access to this care component. In the process of registration or in the first payments, there is a selection process where we apply basic care tools, analyzing basic issues that help us identify risks for violence, other kids under 18, where we have early children pregnancies, we have risks looking at disabilities in the care with the caretaker. So these are tools that allows us to identify issues related to gender-based violence right there. Considering that 90% of the caregivers are women, many of them very young. And naturally, at their age, their economic situation is very conducting to violence. So they are automatically put into the care management program. So that can help us, because the first intervention helps us identify the risks the caregivers might be exposed to, or they might present throughout our intervention and in their lives. So this program helps us prevent gender issues of violence in the family since the first entering in the program. We have they are connected to the districts. The social action technicians also intervene when we have serious cases related to the kids, like violence, negligence. This is all done by our social protection technicians. And we have also in the districts, we have some technicians at community level. We call them, we use our Institute for Child Protection that exercises our programs, and we have permanent technicians, people in the community considered trustworthy, and they are responsible for managing cases where protection issues are fast, that regard access to education and other issues that don't represent risk to the child. So we have these two case management levels. And looking at the process of case management, we have a phase that is called the diagnosis of the society and family. The technicians analyze all issues that affect the family and all those that are related to gender-based violence. And when the technician identifies these risks, one of the stages is creating a prevention plan, an intervention plan that may have to do in sending the beneficiary, the caregiver, or the child to access to health services, legal services, social protection services, or social psychological support, looking at the needs identified at that point. And if it's a violence issue, what kind of support does that woman or family require if they are suffering violence or are at risk of violence? So this is a potential that can allow us to prevent some violence issues in our social protection programs. And we also think that the social protection technicians, when they come into the family, they develop a very close relationship to the family. I'm also a social protection technician. We develop a very close relationship with the family. We have a very important role in guiding the family, especially to eliminate the risks we identified that might result in violence issues. We've made a visit a short while ago, and we identified that in addition to the factors we identified when we implemented the program, we reached some other issues. Most women are caregivers, most caregivers are women. When they receive the grant, they start to participate in the financial system of the community. They are empowered, and these are results that social protection programs should have. They should bring other issues in addition to preventing violence, empowering women. So these are basically the issues I wanted to mention.
Thank you so much, Angélica. I was fascinated to hear how a program that started off with a nutrition focus, specifically for young children, then had a wider perspective looking at the caregivers, mostly women, and how to really support them in a more comprehensive way, and how you've linked some frontline workers, the social protection technicians, who are encountering the families and equipping them with the tools to identify and support women or children facing violence. And now you're going to another dimension, which is to look at what Alessandra highlighted, how we can empower women in these families with other opportunities. I wonder if you could speak to us in your last few minutes about what results you're seeing from this work already.
Que mencionei agora, de estarmos a observar nas
issues we have mentioned, what we have been observing the communities in the implementation of this program. We are applying this program in only one province at this time. We are already elaborating the result of the impacts so we can apply that to other provinces. We have the economic development of the caregivers who are receiving the grants for their children, and we look at nutritional education, if the care the mothers have with the children is improving. It changes their diet, the knowledge they have regarding transforming the food that is available in their community to bring more nutrition and improve the nutritional situation of the kids. And also looking at the access to health services. The visits from our technicians to the community help monitor the situation of how often the kids go to doctor's appointments, help mother make many decisions that can improve the mother's situation in the family and community. You also think this brings great potential to preventing many social risks that might be present in many cities, many families that don't have access to the program. So these are the impacts we are analyzing in the family. We are improving the issues related to the use of food in the community to improve nutrition, and empowering and strengthening women in the care for the children, and fighting against violence within the families. Women have more knowledge about themselves, about how to manage the family, how to take care of the family and of themselves to prevent the risks we found when we entered the family.
Thank you. Thank you. Thank you, Angélica, for those results. It really makes us all want to visit you and see these impacts in person. I see there are many participants from countries like Zambia, Ghana, Malawi, and I'm sure that's resonating with them, the improved child outcomes in nutrition and health access, also dietary diversity, and then the improved care practices, as well as those protection and social impacts for women in the household. Really curious to see if this is resonating with the others and what else we can add to this long list of positive impacts. Thank you, Angélica, for sharing with us your experience, and congratulations for taking this program to such a level of sophistication. We really enjoyed hearing from you. Let me turn now to Ruth. Obrigada. Hi, Ruth. So you recently returned from a visit to Sierra Leone, and you're going to be talking to us about what you saw there and helped to co-create. Tell us a little bit about why gender-based violence is relevant to Sierra Leone's social protection portfolio.
Thanks very much, Lauren, and apologies to everyone. My voice is slightly going. But in terms of why I think gender-based violence is so relevant to the work in Sierra Leone, and particularly the social protection program there, I mean, just to take one step back, I think it's really important to acknowledge that in the sector at large, I think there's been sometimes hesitancy to acknowledge that gender-based violence really is critical and relevant and important to social protection work. So I think that's a myth that we need to bust. And I think, you know, really exciting to be here today and to see in the chat so many colleagues from Unicef, from the World Bank, from the FCDO, from NGOs, from other UN agencies joining the conversation. I think it really represents the sea change, the shift in acknowledging that this is relevant to our work and to our sector. And I also just want to touch on the point that you highlighted, Lauren, in terms of Alessandra's presentation around the potential that social protection has and around gender-based violence. It does sound like a very strong claim, but we do know from recent systematic reviews and emerging evidence that certainly in over 70% of the rigorously evaluated cash transfer programs that cash transfer programs are reducing intimate partner violence. And so I think that's part of why this is so relevant to us. And when we're designing social protection programs and implementing them, to know that there is that likelihood based on the evidence that we have to date, that it reduces intimate partner violence. You know, why wouldn't we want to support and enhance and amplify those results? In terms of Sierra Leone specifically, the Social Safety Nets program was launched there in 2014, and it's very much around a broad policy objective of building the social protection system, so building those basic blocks in terms of social assistance and progressively expanding coverage over time. And it has a set of objectives around income security, of course, increasing investments in human capital, mitigating shocks, increasing consumption, and so on. And this is something that I really wanted to shine a spotlight on, that, you know, we can't, as social protection practitioners, as policymakers, in our various roles, talk about having a program which is about making investment in human capital without acknowledging that gender-based violence and addressing that as a core part of our work. You know, when we think about the impact on girls and women in terms of physical and mental health, in terms of time lost and to access economic opportunities or education, you know, in of itself a human rights abuse, but also many knock-on effects. So, you know, that's a key part of why it's fundamental and relevant. I wanted to highlight also that I think there are a number of different entry points. So first of all, around the basics in terms of GBV risk mitigation. So, you know, we know that for every country, every context, gender-based violence is I think
sorry, somebody's just coming in. Okay, I think we're good. Keep going, Ruth.
We know that we know that gender-based violence is going to be affecting women and girls in all contexts, but we know that the prevalence rate is very high in Sierra Leone. 61% of women have experienced violence from a current or a partner in the past, and we know that violence can be prevented. So, you know, that's kind of a very big picture, and we know that in our social protection programs, not just the program participants, but also for staff that are delivering the program, and implementers, that GBV is going to be a factor. It's going to be, we're going to have survivors and we're going to have perpetrators in these large scale programs. So that needs to be acknowledged, and we need to, as a basic aspect of good programming, as Alessandra said, you know, basic good gender programming, basic good programming, to ensure that risk is acknowledged and accounted for. And then the second entry point I want to highlight is really around these response services. So, you know, fantastic to hear about the work in Mozambique. And I think there are a number of other really good examples of where social protection programs and systems are acknowledging the reality that GBV exists and working out what are the ways to strengthen linkages to response services to ensure that the grievance and redressal mechanism in a social protection program it has that kind of active referral. And then third and finally, this really intentional work around prevention. So, you know, we know from the evidence there's a potential that social assistance programs can contribute to those results, and we know that it's a priority and fundamentally linked to our objectives around addressing poverty, human capital, exclusion and vulnerability. So I think it's a no-brainer. And I think the other thing that I would highlight is that having worked on gender-based violence and gender programs for a long time, as well as social protection, it's rare that we have the resources to work at scale on GBV in the same way as social protection. So, you know, programs that are reaching, in Sierra Leone's case, new work on to reach 35,000 beneficiaries. There are many countries where coverage is in terms of millions, and so if we can get the design tweaks right, or link to effective services or components that will address and amplify the prevention effects, that's very exciting. And I think, you know, for all of us in the room, clearly, who want to progress girls' and women's rights and address GBV, that's an opportunity that's not to be missed.
Thank you, Ruth, for emphasizing how GBV is a reality and we must design for it in mind, and look at the positive ramifications that can happen from that. Zooming back into Sierra Leone, can you tell us how then Sierra Leone harnessed that opportunity and has incorporated gender-based violence response, prevention and mitigation now in its social protection program?
Yeah, absolutely. So I sort of started to touch on it a little bit, but in terms of the context, the social protection work, of course, in Sierra Leone is led by the government. It's implemented by a number of different implementing agencies in close collaboration. So we have the National Commission for Social Action, the Anti-Corruption Commission and Statistics Sierra Leone, and working in partnership with the World Bank and of course Unicef and others. I thought it would be useful to drill down because of the support that we provided quite recently, specifically to part of the emergency response during the COVID pandemic. So the government took the decision to scale up its support to this 35,000 households nationally, and also plan to scale up further. And they also plan to effectively double the benefit size. And given these changes, questions were raised around GBV, increased risk, what might the potential be for addressing violence, particularly as we know that in the pandemic, violence, gender-based violence has increased in many, if not most contexts. So in very immediate actions, we then developed and led a 2-day social protection and GBV workshop. That was with over 65 participants from all of the key different agencies, the ones that I've already mentioned, but also other ministries, civil society organizations, representatives focused on women's rights, on disabled persons' rights, and also on youth, to ensure that we had that kind of multifaceted set of perspectives on what the challenges were and risks, and also a coalition to work together to take it forwards. I thought it might be useful just to illustrate a little bit of what we did in more detail. So unpacking what we really mean by GBV, and also preventing sexual exploitation and abuse, what that means in the context of Sierra Leone, and what we've learned from things like the Ebola epidemic, which I worked on in this 2014 to 15 period, and we saw that there were increases in gender-based violence and harmful practices at that time. And then really unpacking what are the key considerations for GBV risk mitigation. We heard sort of best practice from the World Bank in the region around their GBV risk mitigation approaches, some of UNICEF's experience with shifting social protection towards more gender responsive or transformative approaches. And then from that, we really honed in on what are the operational risks on GBV, and what are the opportunities for, in the longer term, really supporting action towards prevention. And so that's sort of at every level, from recruitment, policies, staff capacity and training, through sort of information and then some more behaviour change components that could be linked to social protection work in the future. And the other thing that I just want to flag around these workshops is, we started with the GBV risk mitigation because that's critical and fundamental. We need to get that basic component right. But it's so important that sits within a fundamental clear framing of understanding that at its heart, GBV is a manifestation of gender inequality, and that if we really want to address GBV and girls and women's rights, we need to look at gender inequality, and we need to look at how the social protection systems respond to and support progressive change in that agenda. So we also unpack, what's the evidence in the region in particular around core gender equality outcomes in terms of social norms, the potential for social protection to support that. I mean, we can talk a bit more about that maybe in discussion, but some of the things that others have highlighted in terms of supporting social networks, social capital, women's economic empowerment, these other components that combined with the core social assistance program can support that transformative change.
Really exciting, Ruth, and thank you for taking us in this future direction, this theme of going beyond mitigation and response to really uplifting women and girls situations and addressing that gender inequality that's at the heart of gender-based violence perpetuation. Thank you for joining us and that exciting example from Sierra Leone. Looking forward to the Q&A. I just want to invite everybody who's participating. We've got some great questions coming in the Q&A, which I'm taking careful note of. And please feel free to keep adding them as our speakers are talking to their experiences and the evidence and findings. Anything that's coming to your mind, anything you disagree with, something that you think is absolutely right and want to hear more about, just pop that into the Q&A or into the chat, and I will make sure that we address it in the Q&A. Let me turn now to our very last speaker, Charlotte. Can you hear us okay, Charlotte? There you are. Wonderful to see you. Thank you so much for joining. I know there was a challenge joining on, so I feel really excited to see you doubly that we overcame the technical glitches.
I'm on my personal mobile, so apologies if the sound and the video isn't great, but hopefully it's good enough.
It looks perfect.
Fantastic, thank you. So it's just absolutely brilliant to see people come together in this forum, and such interest in this area. I find in development, we often are very siloed and we're passionate about our particular area, and it can be quite hard to get people to think outside that. So it's just wonderful to see the cross-pollination here and so many people who are here saying they're social protection practitioners, and GBV practitioners was really filled me with hope, and what powerful interventions from the other panelists so far as well. I mean, a lot of what I have to say really chimes with what the other panelists have said. So I hope you can bear hearing it for another time. Maybe repetition isn't such a bad thing in this context. But, we know that it's essential to mitigate the risks of GBV in social protection operations. We know that there are high risks, male backlash when resources are made available to women, or sexual exploitation of programme actors by delivery partners and other actors. So mitigating those risks is really the bare minimum of what we need to do. And I think we've known that for a very long time. But I think what this conversation is about is taking us that step further, challenging ourselves to go beyond just risk mitigation and actually how do we use social protection to prevent GBV rather than just mitigating against the risks of it actually being made worse. So I think over the last 10 years, we've really seen a huge expansion in rigorous policy relevant evidence, which shows we can prevent GBV. And I think, a lot of people think, social norm change, it's going to take generations. What I find fantastic about the What Works to Prevent Violence programme, which is an FCDO flagship programme on GBV, which has really helped build the global evidence base on what works to prevent violence. What we actually found is that you can actually prevent violence. It is preventable. It doesn't have to take generations. So about half the projects we evaluated in contexts as diverse as Ghana, Pakistan, DRC, achieve reductions in violence of around 50% within the programme timeframe. So, I think that is some really powerful evidence that we can build on. One of the most exciting findings to emerge from this expanding evidence base is that economic transfers can actually reduce intimate partner violence, even when they were never designed with GBV in mind. This is a point that Ruth made as well. So just think what we could achieve if we were actually intentional about how we design cash programming to reduce GBV. And I just wanted to set out two particular priorities for action. So first of all, there's a whole bunch of low-hanging fruit, and I think Alessandra talked about this as well, in terms of making small tweaks to how transfers are designed and delivered so that we can maximise the positive impact on GBV and IPV. So, you know, you need a really good understanding of the context and evidence to guide these decisions, particularly in humanitarian settings. But I think we can go beyond just those small tweaks and just, you know, designing the programs carefully. I think we can be really ambitious and drive innovation to deliver sustainable reductions in GBV over the long time. So, you know, testing the potential of complementary activities, cash plus to reduce GBV through addressing some of the root causes of violence against women and girls. And the evidence from What Works and other programs has identified some essential elements for reducing GBV that could potentially be integrated into cash programming. So, for example, pairing economic transfers with couples or parenting programs to shift attitudes. So it was really interesting to hear colleagues in Mozambique speaking about integrating that kind of parenting support into the program. Behaviours on gender and teaching skills such as communication, couples communication in particular. And evidence, this is something Ruth raised as well, evidence suggests that group-based activities are a really important platform for women's social capital, regardless of their content, actually. Just getting women together is important. So delivering elements of a cash transfer programme in a group-based format might be something that you know, could be looked at and could help accelerate gender equality results and reduce GBV alongside the primary outcomes of the social development programme. And again, this is something that I heard Alessandra talk about in terms of the group-based formats. As well as design choices, it's also really important, and I think this is again something that came out of the What Works programme, that implementation quality is a massive factor in whether the interventions are effective in reducing violence. Building implementation capacity, equipping a skilled workforce will be crucial for success, particularly in low resource settings, and it's a key challenge across the field. So, you know, just to summarise, there are some really major opportunities. We have the evidence there. We've got the evidence base that we can build on to bring together social protection and GBV objectives. So let's go for it and grasp those opportunities. Thanks.
Thank you so much, Charlotte. And I wonder if you would allow me just to ask you one follow-up question, which is, you know, there's some tension around social protection. I've heard social protection advocates talk about one of the beauties of social protection programs is they don't require a lot of administration and oversight. They're about getting resources in the hands of poor people to make their own choices. And yet both you and Ruth, as well as Alessandra, have talked about the importance of well-designed and quality implementation programs. Do you not think there's some kind of contradiction there? And how do we overcome that?
I mean, it's certainly something that is a challenge, and Ruth alluded to this, that we have struggled to take GBV programming to scale. I think that's fair to say. It tends to be in a smaller scale, and as you say, the massive benefit of cash transfers is that you can do them at huge scale for very low transaction costs. So I'm really excited to say that we're actually launching a second phase of the What Works to Prevent Violence programme, and it will specifically be focused on taking evidence-based interventions to scale. So how do we scale some of this stuff? You know, part of that, it will look at adapting social protection programs to optimize their impact on violence. So we're going to test cash plus components, but with a really rigorous research component in there to understand the costs and how these components can be scaled in a way that's actually implementable and doesn't massively increase the costs of those programs. And also FCDO has a gender responsive social protection programme that funds cutting edge research on the potential of social protection to enhance gender equality outcomes. And people may have heard of the GRASP research programme that's done collaboratively with Unicef Innocenti. And it provides technical assistance and expertise to leverage large scale social protection investments by the FCDO, the World Bank and Unicef. And it uses examples and evidence from these to build a robust evidence base on what works, how it works, why it works, including on GBV prevention. You know, and I think opportunities like this to come together, this webinar, are fantastic opportunities to challenge ourselves on some of these things and share understanding, share what's worked, review how do we make this work at scale, and share that evidence base globally. So, massive thank you to you for bringing this group together, and hopefully together we can overcome some of these challenges. Thanks.
Thank you so much, Charlotte. Congratulations on the second phase of What Works. We'll put a link into the chat about what Works is currently. And for those who don't know it, it really is the most amazing collection of robust evidence of what works to reduce and prevent violence against women and girls. It's synthesized so beautifully and easy to understand. A great resource. I loved it in the field when I was designing and implementing programs. And also we'll put a link to the GRASP program, which helps to demystify what is this gender responsive social protection, what does it look like, and what are we learning about successful approaches, so that you can read more about that. I'm going to turn now to Q&A. We've got some fantastic questions coming in, and thank you to the participants that keep growing for your engagement and excitement with the topic. One of the questions we have is around reducing violence through social protection programs. What kinds of violence are prevented and what are not? So I'm going to pass that either to Ruth or Alessandra. Next, we're going to be talking about, is anybody looking at measuring outcomes for men in these programs? Angélica, you'd spoken about how critical it was to support female caregivers. How about the male caregivers? What are we doing to measure what's happening with them? So Angélica, I'll be asking you about that. And then somebody asked, is any country framework incorporating these aspects that we know about GBV mitigation, prevention, and response? So I might be turning to, let me see. Actually, let me ask Alessandra about that, and Ruth about what we know about the types of violence that are being prevented. So let me start with you, Alessandra. Are you comfortable with that? Great, over to you.
Sorry, I was just scrolling through the chat. Can you repeat the question? It's hard to multitask.
No problem. Can you think offhand of any country that's already got a social protection framework that's incorporating these gender-based violence learnings and prevention aspects?
Sure. I mean, I think it's, as several panelists have said, I think it's sort of an emerging agenda. So I think there's a few countries that I can think of that are sort of, taking steps in that direction. But I think it's kind of collectively, I think we all have a ways to go. So the Safety First is actually drawing on case studies that we did in 5 countries. So those are Zambia, Pakistan, Cameroon, Bangladesh, 4 countries. So I think the sort of the social protection practitioners that we've engaged with as part of those case studies, I think, a lot of them are thinking and tinkering to try to make those linkages. But, I think it's probably fair to say that, we're all learning by doing, and I don't know that, anyone has yet figured out the best way of making all of these linkages.
Thank you so much, Alessandra, and I'm looking forward to reading more about those details and country examples. And I also invite any of the participants to put in the chat if you know of a country that is starting to incorporate these aspects and this evidence into their policy frameworks. Please do. Let's turn to the next question about what kinds of violence are being prevented and what do we need more research about? Ruth.
Thanks so much. I think the summary on this is that we have a lot more evidence specifically around cash transfers within social protection and their impact on intimate partner violence, and within that physical and sexual violence. So we have less evidence around emotional abuse, controlling behaviors, and so on. It's a field that's still growing, and there's also promising but emerging evidence specifically around sexual violence for adolescent girls. So I would say, I gave that very macro in my, running through points. 70% of the rigorously evaluated cash transfer program stat, but we do need more evidence in terms of impacts for different age groups, in terms of humanitarian contexts, in terms of particular regions, sub-Saharan Africa. We're looking through GRASP, through this research program that UNICEF and the FCDO are partnering on, but also, in many other cases, the Transfer Project and other partnerships to grow this body of knowledge, because we do need to understand more. And that's partly why I wanted to highlight the sort of GBV risk mitigation point. We're also looking in Sierra Leone at the next phase of the program, and how do we have a much more intentional approach in terms of response services and prevention. But as with any programming, we can make no assumptions. Actually, we need to make sure that we get that risk mitigation work in place.
Thank you so much, Ruth, and for highlighting those research gaps. Angélica, may I ask you to tell us a little bit more about how you're working with male caregivers and if you're measuring any outcomes for them? Please go ahead.
Thank you. As I said before, we enter the family through the situation of the child. The grant is for the child. However, when we identify risk situation, we look at the family. And the social familiar diagnosis help us identify the risks the child exposes to, including the parents and the male caregivers. And when we identify that the risks have to do with the male caregiver, we work on these risks. The plan will be to respond to these risks presented by the male caregivers. For issues related to men, and the way we work have to do with sexual abuse, excessive consumption of alcohol or drugs that might influence the situation of the child in the family. Our intervention in the family includes not only the child, the mother, but also the male caregiver and the structure of the family. The intervention faces the family. We believe that a healthy environment for the child in the family will naturally influence the well-being of the child. So our interventions also include the identifying risks the man presents or brings into the family that might represent risk for the child. I also want to comment a little bit the types of violence we have identified that might be prevented. One of the interventions we have been doing when selecting the families, we identify women that have children or early pregnancies when they're very young. And in this first phase, we identify that at least 17% of our case management cases are women that had kids very early. So we look at that specific aspects of each of these girls that became mothers very early, and we help them facing some situations, trying to bring that girl back into their parents' families that are separated because of that issue, and for other issues that or interventions that might be necessary in that. Another violence is domestic violence, sexual violence, emotional violence are violences that might be prevented with all the interventions that we make. We intervene with the family. The social technicians participate in solving issues that bring risk, especially with the situations that have the potential for violence. And if they identify that violence is already happening, they try to see how this might affect the family and the child and how to solve that. Thank you.
Thank you so much, Angélica. I was taking some really great notes from your experience here. We've also got a question coming in that I believe Ruth is going to answer. How are the social protection initiatives linked to broader gender-based violence policy and program work so that we can be more sustainable in our approach? Thank you very much to you and women for asking this great question. Over to you, Ruth.
Thanks very much, Lauren. Yeah, I greedily asked if I could answer this live because I think it's so important. I really wanted to highlight it from a couple of different angles, and also, would love to hear people in the audience's thoughts on this. The first is, I think we need to do a much better job at actually creating space for girls and women and women's rights organizations to participate in shaping social protection programs and systems, and that's at multiple levels. It's about the policy making and the decisions around budgeting and priorities. It's about sort of when the program is being implemented, their voices being heard, that feedback being taken seriously, program adaptations being made. And certainly when it comes to GBV, alongside GBV specialists, ensuring that girls and women's voices are being heard and that they're getting to shape what the priorities are. So that's one thing, and I really wanted to highlight. And the other is, I think, around these plus components and implementing. As Alessandra said, we're not expecting every social protection practitioner to jump up and add to their jobs becoming GBV specialists and implementing these additional programs. It's really about the linkages and the partnerships and drawing on the expertise and existing programs or systems that are in that country context. And so, looking at what are the existing response services, how can we link to them effectively, how can we support them, how can we make it part of social protection systems to provide that additional support where needed. If there are a small scale or even better at large scale, but programs that are working on prevention using effective models, can we enhance those? Can we support those to scale up? Can we make that part of the social protection policy or strategy to link to those? So I think it really is about that partnership and those connections rather than sort of one sector sort of taking it all on, because that's obviously not a sensible approach. And I wanted to highlight a nice example of this that actually the World Bank and the government of Zambia really led on, but in fact they found that on a program, Jewel, it's called, that focuses on women's economic empowerment and girls' education, that there was a temporary increase in violence. Sorry, I feel like Alessandra should be talking to this, but just because it's really relevant. And in response to that, partner with BRAC for some sort of community dialogue sessions to really address that and to resolve the issue. So it's just a practical example of partnering with the organizations that are there that can provide what is needed, and I think that will often be girls and women's rights and specialist organizations. I'd love to hear others' thoughts on this.
Thank you so much, Ruth, and thank you for emphasizing a growing theme of this webinar, not just to support group-based activities for women, but also to partner with women and girls organizations from the very start and asking them to help shape these social protection programs with impact. And then the third piece, to continually seek their support and advice in the feedback and delivery of these programs so that it really is delivering impact at scale on all fronts. We do have another question around, and again, touching on this issue of patriarchy. How do we really take into account culture and tradition, especially when it is largely patriarchal, in these types of programs? Any experiences that anybody would like to share? Perhaps Alessandra, this might be for you. And again, it's this area in terms of next steps for research. How do we tackle these patriarchal norms? How do we be both contextually specific, but also bring in the global learnings? And what are we learning particularly about working with men and boys? So I wonder, Alessandra, if you want to take a stab at any of those aspects that you know about, or perhaps some next steps for the research that are on the frontiers.
Sure, thank you for that question. I mean, I think that question gets at something really important, and I think I mentioned this at the beginning, but I think it bears repeating. I feel like the Safety First Toolkit should come with a disclaimer across the top that says, this is not a cut and paste job. By no means can you just kind of lift a solution from one context and try it in another one? Obviously the social norms, the drivers of violence are going to be very context specific. So it's really important to do your homework, to work with local experts, and try and understand the context that you're operating in. So what we have in the Safety First Toolkit.
If you could come closer.
Sure.
Again. Thank you.
Sorry,
yes.
I keep moving too far away from you. So what we have in the Safety First Toolkit is a range of questions that we hope will kind of help you in that process of understanding the local context and hopefully identifying entry points that might work for you. So I think in a very patriarchal context, it's obviously really important to engage the norm holders up front and the gatekeepers. And I think we have a couple of examples of programs, for instance, that have found that mothers-in-law, for instance, are a very key but often sort of overlooked ally or not, as the case may be, right, in terms of empowering women. And so engaging them up front, getting their buy-in, sort of understanding that, the intervention, finding ways of making sure that the intervention can kind of benefit them too, and having them on board is really key in terms of preventing backlash against, against younger women in the household who may be the daughters-in-law or not. So, I think it's really about understanding, understanding the context and the power structure and who holds the norms, who is empowered and expected to potentially enforce sanctions against people who transgress those perceived norms. It's, I don't think there is a sort of a ready-made answer, but I think those are some of the issues to explore.
Thank you so much, Alessandra. I wonder if I might do something a little different. I'm going to ask the participants, having listened to these questions and the responses from our fabulous panel, whether you might reflect for a moment in the chat of what is your biggest takeaway from today's webinar. What was your greatest learning? And if you can pop that into the chat. What did you learn from today? What did you find most interesting about today? And just type it into the chat for us. I'm so cognizant of how many experienced researchers and practitioners we have online from countries across the world that are at this very moment designing, implementing, overseeing, and evaluating these kinds of programs. Anyone brave enough to share their takeaway in the chat? While they're doing that, I'm going to turn to you, Angélica, to think for a moment of something you wish maybe you had done differently in your program, looking back. Any sort of lessons learned or something, yes, that you would do differently? I know when I was running programs in different countries, I look back on how much I missed at the time, especially, for example, I wish that I had created a peer feedback group from women and girls on the programs that we were doing. I realized too late how important that was. Please go ahead, Angélica. Any reflections on what you wish you'd done differently?
Well, looking the course of the program, I believe that we could have included in the training of the technicians and agents and people who are going to work with families, for example, the concern in regard to sexual and reproductive health, because we focused on nutrition. But throughout the work with our colleagues, we verified that contact with women, that content was not well addressed. And it was important to address this with the girls and the women, because it helps with the fight of violence that is gender-based. The choice of women when she wants or does not want to have kids, for example, how we can support women in making their decision and managing this. So one of the contents that if we could have considered way back, I think we'd have much better results with women in regard to raising and having kids. Another concern is, if I could, for example, it's not a matter of I could have done or should have done, but if I had the condition, is the training capacity, the availability of technicians and agents to go to places and manage cases. We need more technicians and more people involved. And the number of technicians and agents today does not allow us to cover many families at the same time. We need to decide what families we can help. And of course, there are some that are under very severe risk, very difficult, violent situations. But we have this ambition with this perspective, and we wish this could have been different. If we could cover more families in the program, that would be much easier, much better. I think it's a great possibility. I think that if I could change, this would be it.
Oh, those definitely resonate with me, Angélica. The adding a more deliberate sexual and reproductive health and rights components to these programs, and really thinking about the workforce. How that precious workforce is so much depends on them, and yet they often get very little support, are in short supply, and need the training and skills that we know make a difference. So thank you very much for that. Thank you to all the participants who are putting some really amazing takeaways in the chat, which I will try to summarize as we start to close. I'm going to ask the amazing team from socialprotection.org to please put on the link for the final takeaway survey as I do so. So what we heard today from this great panel, and a big thank you to all of them for joining us today and sharing their insights, both local and global. We heard that GBV is a reality across every country where we're working, and that we need to design for this in mind. And we can do that from very simple steps in the recruitment of the social protection workforce, to their training, to making sure that we are adding on the risk mitigation and response aspects on how to identify and refer cases. And then challenging ourselves a little to go a bit further onto prevention. The evidence base is really building that we can do more to not just mitigate, but actually prevent gender-based violence. We heard about the group-based activities. We heard about the add-ons of parenting and caregiving from Mozambique and a number of other contexts. And third, we heard about the need for more research across different humanitarian and development contexts, for different age groups, for different types of violence, and many more. And we heard too about the tremendous power of engaging women and girls in designing, in shaping, and feeding back on these programs, so that we do more to really get at the heart of the issue, which is gender discrimination and inequality. So now you should be seeing a survey as soon as you log off from today's conversation that will ask you about your experiences. And I hope you've enjoyed it as much as I have. It's been a really stimulating conversation with an absolutely amazing turnout and really, really exciting findings to share. Thank you, Karine, for sharing with us the closeout. Thank you, everybody. It's been a great pleasure. I've really enjoyed being here today. Bye, everybody.